Breaking news. Global health authorities are now tracing passengers across multiple countries after a deadly hantavirus outbreak linked to the cruise ship MV Hondius. The outbreak involves the rare Andes strain of hantavirus, one of the few hantavirus strains known to have limited human-to-human transmission. So far, multiple countries have launched monitoring and contact tracing operations after infected passengers and crew traveled internationally. Here's what is happening right now. The outbreak began aboard the Dutch expedition cruise ship MV Hondius, after several passengers developed severe respiratory symptoms during the voyage. According to the World Health Organization, 8 cases have now been reported, including 3 deaths, with 6 laboratory-confirmed infections linked to the Andes virus strain. The situation quickly became international because passengers from more than 12 countries had already traveled across borders before the outbreak was fully confirmed. Countries involved include the United States, Canada, Netherlands, Germany, United Kingdom, Switzerland, France, South Africa, Denmark, Singapore, Spain, and Sweden. Health authorities are especially concerned because some passengers disembarked earlier during the trip before full contact tracing procedures were activated. In the United States, health officials are monitoring exposed passengers across several states, including Georgia, Arizona, California, and Texas. The CDC has now activated a Level 3 emergency response, while American passengers returning are being transported for medical monitoring and quarantine in Nebraska. In Canada, public health officials confirmed Canadian travelers were aboard the ship and are now carrying out risk assessments and border monitoring. European health agencies are coordinating with the WHO to track passengers who may have crossed through multiple airports during the virus incubation period. South African authorities also started precautionary tracing after critically ill passengers were medically evacuated there earlier in the outbreak. Experts say the overall public risk remains low for now because hantavirus normally spreads through contact with infected rodents, not casual human interaction. However, the Andes strain is being watched closely because previous outbreaks in South America showed limited person-to-person transmission among close contacts. Health officials are emphasizing early symptom reporting, isolation of suspected cases, international cooperation, and rapid contact tracing to prevent further spread. Symptoms can initially resemble the flu: fever, muscle pain, fatigue, and headaches, but severe cases may later develop dangerous breathing complications. The World Health Organization says this is not currently considered another COVID-style pandemic threat, but officials are taking the outbreak seriously. This remains a developing global health story. Stay informed, stay calm, and follow trusted public health updates. Follow for more update, hit the subscribe button. StoFad TV, Vancouver, Canada.